Good afternoon and thank you, Chair. Present is Dr. Lomo, Ms. Kreko, Ms. Shabangu, Mr. Mutuba, Dr. Leroux, Mr. Mutubazi, Ms. Marais, Mr. Van Staden, and Dr. Litlape. I've received apologies from Ms. Clark and Ms. Mailola. We are going to receive two presentations from Vaperite and from Professor Max. Thank you, Chair.
All right. Welcome once more, honorable members, and welcome to the staff that is supporting us in Parliament. Also, special welcome to those who have come in to interview the Portfolio Committee on this tobacco control bill and the electronic delivery systems. We will start with the first presenter.
Recording in progress.
Who will then be given not more than 30 minutes to present a document that we already received from yourself. Thereafter, honorable members will interact with your presentation through questions and the clarity-seeking comments. You then thereafter come back to, after you have listened to all, so you take a pen and paper after a presentation so that we all ask one time, and then you come back to clarify on those points that honorable members would have raised. For any member who has got a challenge with a video, we will still wish to hear your voice. So you will assess whether the bandwidth is allowing you to have both the video and the voice. For now, let me hand over to the presenter who will introduce himself or herself and those that are with, and then you start the presentation. Thank you very much.
Thank you, Dr. Lomo. I just want to advise that I am sitting in Dubai. I'm actually attending a vape expo, and I'm not 100% sure of the bandwidth in this hotel that I'm in, but I will proceed. I'm going to share my presentation. Okay. Once again, good afternoon, Chairman Lomo and honorable committee members. Firstly, I would like to extend my gratitude to Ms. Majalamba for the extremely professional and highly efficient manner in which she facilitated my being able to present to you today. I am addressing you both as the founder and as a joint managing director of Vaprite Pty Limited. Vaprite is one of the larger vape companies in South Africa, encompassing both brick-and-mortar retail outlets, as well as an online e-commerce website, and additionally, a wholesale division and a manufacturing division. From the outset, I need to make it very clear that I am not here to address the science around vaping, as this has been addressed by others, including Kurt Yeo of Vaping Saved My Life. I am not a doctor or a scientist. However, what I will state is that 10 years ago, Vaprite's first retail outlet was opened. Since then, we have served over 100,000 unique customers. We have never had a customer report any form of ill health or affliction as a result of vaping. If even one of those customers had experienced any negative health effects from vaping, they would surely have contacted us to advise us. What I'm here to address is the retail side of the vaping industry. How the proposed bill is affecting us right now, how it may affect our ability to continue as a viable business, the issue of youth access, and solutions are proposed to restrict youth access. My personal story is that I started smoking cigarettes in high school at the age of 16 and continued smoking until I was 34 years old, quitting when my first child was born. Unfortunately, I started smoking again at the age of 41. In 2013, at the age of 46 and desperate to quit smoking, I discovered electronic cigarettes. I was able to quit smoking immediately, did not experience withdrawal symptoms or any desire to return to using combustible cigarettes. I quit using a chocolate flavor and a hazelnut flavor, but we will get to the issue of flavors. Now, at the age of 58, I have been tobacco-free for 12 years, and I am healthier than ever. Getting back to 2013, when I quit smoking, I was both an SAA pilot and an entrepreneur. And I recognized what for me was a miracle product that few knew about but millions could benefit from. A nicotine delivery system without the harmful and deadly tar, carbon monoxide, and carcinogens found in cigarette smoke. And so Vaprite was born. As much as I got great pleasure and professional satisfaction from transporting passengers safely by air all over the world, the greatest satisfaction of converting smokers from deadly cigarettes to far less harmful and non-deadly electronic nicotine delivery systems encouraged me to accept a retrenchment package from SA in 2021 and to be able to give my full attention to running and growing Vaperite. Vaperite is headquartered in Limbro Business Park in Sandton, Gauteng. We have 38 stores nationwide, with that number set to increase well above 40 before the end of the year. Our employee count is over 140 full-time employees nationally. Most of our middle and senior management, and even some of our sales staff, have been with us since inception or joined us during our initial growth years. We are currently operating on a knife's edge while awaiting the outcome of deliberations and consultations over the final composition of the Tobacco Products and Electronic Delivery Systems Control Bill. How are we affected? To be very honest, we are not sure that our company will survive the current proposed version of the bill. The bottom right corner of the slide contains a legal clause we have asked our lawyers to compose for insertion in all new retail leases as well as all lease renewals. This is to limit the financial liability the directors of Vaprite face if we cannot operate profitably after the implementation of the bill and are forced to close all our stores and retrench all our staff, effectively going out of business. The excise tax imposed on e-liquid by National Treasury has already affected our profit level significantly. The reason given by National Treasury to motivate this tax was to address the rise in youth vaping and the illicit tobacco trade. During public participation over the proposed tax at the time, I advised Treasury that the result would be exactly the opposite, and my predictions were correct. The illicit trade is growing exponentially as criminal elements smuggle vape products through our porous borders, avoid excise tax, and then legitimize the products by distributing them through legal front companies. Why are containers of disposable vape devices being shipped to Mozambique and Namibia when there is literally no market for these goods there? The answer is simple. They are trucked through our border, either assisted by corrupt customs officials, or they have routes which are not subject to the presence of customs officials. Then there are the containers arriving at Durban port with vape products which are not declared. SAPS recently posted about just such a seizure, where they traced a container from Durban port to a Johannesburg warehouse and found illicit vape products in the container. The warehouse manager was arrested. Additionally, many of these illicit products are sold to the very retailers who sell to the youth. They will supply anyone, including China malls, electronic goods kiosks in malls, and any convenience store, whether operating legally or illegally. This has resulted in the increased availability of disposable vape devices, which is the vape of choice for those under 18. The tax has also enabled a lot of companies to effectively compete with established companies like Vaprite by allowing them to supply FMCG retailers, which is where most of the youth purchase their vape products. Vaprite's wholesale department has very strict criteria for retailers applying for a new account. They must have a registered company, a VAT number, and a fixed business address. If they are an online e-commerce store, they must already have an established website. And lastly, regarding the excise tax, is that it discriminates against the poor. The cost of the excise tax has placed these products out of the financial reach of the poorest of the poor. Considering that it appears that this committee is warming to the assertion that vaping is a significantly harm-reduced method of nicotine delivery, why should this life-saving benefit only be available to those who have means. Sorry, I'm just struggling with one screen here. Let me get on to slide 3. With regard to the issue of youth access, with youth being defined as anyone not yet 18 years of age, and where in South Africa, a person of 18 is considered an adult, Vaprite is proposing the following steps be taken by the Department of Health. Firstly, the legal age for using any nicotine product versus just tobacco products should be written into law. As such, we propose an immediate amendment to the current Tobacco Products Control Amendment Act 63 of 2008, in that the wording be amended to read, to prohibit the sale of tobacco and nicotine products to and by persons under the age of 18 years. This could be actioned immediately and would not be opposed by reputable or ethical retailers of these products. Secondly, any retailer selling any type of electronic delivery system, whether with or without nicotine, be licensed in the same manner that alcohol retailers are licensed. The mechanism is already in place for alcohol licenses, so how difficult would it be to apply the same to nicotine? What this will do is to force the current mainstream retailers, such as supermarkets, petrol stations, and forecourts, who allow vape products to be purchased by under 18 consumers, to abide by the law and age verify all purchases. Unfortunately, this will increase the size of the already rapidly growing illicit market, but will also allow for the identification and prosecution of those retail outlets who are not licensed or who are licensed and are selling to underage. Then, in addition, we propose 2 additional issues which we feel need to be addressed legally and legislatively. The maximum nicotine strength in any liquid intended for use in electronic delivery systems should be limited to 3%, from the current very prevalent 5% specifically found in many disposable vape products. The main reason disposable vape manufacturers use 5% nicotine formulation is that it is more addictive than lower levels of nicotine. Lastly, we strongly support a ban on single-use disposable vape products. The overriding reason for banning these products is due to the massive harm they do to the environment. In saying that, I have personally written to the Department of Forestry, Fisheries and the Environment and requested a meeting with the Minister. The latest communication from the personal assistant to the Minister is that it has been referred to the relevant official and that feedback will be provided once it becomes available. I would like to read part of our motivation to DFFE. It was as follows. From an environmental aspect, every month over 1 million single-use disposable vapes are thrown away with their batteries throughout South Africa, and the vast majority are not recycled. Where other vape products differ from single-use products is that the batteries are separate from the liquid tank or pod and are not thrown away, but are reused until they fail, which could be after years of use. If required, once I'm finished with this presentation, I can physically show you what I'm referring to between a single-use and a regular disposable. The UK government recently banned single-use disposables. This ban was implemented by the Department for Environment, Food and Rural Affairs in the UK. This guidance is extremely well written, and I recommend that the Portfolio Committee on Health Committee members peruse this document as per the link at the bottom of the slide. We believe that banning single-use disposables would be better achieved through DFFE. As can be seen in the photo on this slide, which is of confiscated vape products from one single search at Brakpan High School just a few weeks ago, literally every vape in this photo is a single-use disposable. It is the vape of choice for those under 18 due to its plug-and-play design. What I need to make very clear is that Vaperite has voluntarily chosen to self-impose an age limit of 18 on all sales. Customers entering our stores are greeted by a sign stating, "No under 18." All of our products and marketing clearly state no under 18. In South Africa, the legal age at which a person becomes an adult, also known as the age of majority, is 18 years old. This means that individuals gain full legal rights and responsibilities upon reaching their 18th birthday. Before the age of 18, individuals are considered children and are subject to certain legal limitations and protections. Vaprite is in the final stages of implementing an advanced age verification system on our e-commerce website provided by the company Secure Citizen. This is a first in South Africa for a vape company. It will also be used for in-store customer accounts. It is a once-off verification using the customer's ID number, which will match that ID number to the name of the South African citizen or flag the ID number as being false. However, this committee also needs to accept that there is an obligation for parents of children to take responsibility for their child, as any payment method used by that child is provided by the parents. Vaprite asks for ID from any customer we suspect to be under 18. Our staff are trained to identify fake IDs and will confiscate any ID that we suspect to be fake. We have, believe it or not, actually had a parent contact us requesting that we give them back their child's fake ID. At Vaprite, we are very sensitive to branding, flavors, and marketing. The first question we ask ourselves when marketing to our consumers, as well as branding or procuring new flavors for e-liquid or new hardware, including disposable vapes, is the following. Is there anything about this marketing or branding or products that could be considered or construed as being attractive to or targeting the youth, being those under 18 years of age? We abide by our company motto, which is, if you smoke, switch to vaping. If you don't smoke or vape, don't start. This is the advice we give to anyone wanting to start vaping who does not smoke cigarettes. Vaprite is all about getting smokers to quit smoking using electronic nicotine delivery systems. To do that, we have to offer a variety of flavors to keep them engaged and satisfied. As I mentioned earlier, the two flavors that allowed me to quit smoking were chocolate and hazelnut. Kurt Yeo mentioned that he used strawberry flavors. Neither of us were under 18 when we quit, but in my case, 43 years of age. Anyone claiming that Vaprite sells flavors aimed at the youth is simply blowing hot air. The fact that all of our customers are 18 years of age or older dispels that claim. At 58 years of age, I have access to any vape product I desire. And yet my current flavors of choice are cherry vanilla, mango on ice, and banana strawberry. That is what keeps me engaged and stops me from returning to using cigarettes. What we agree with and completely support this committee on is that a flavor such as a branded soft drink, a cookie, a candy, or any other permutation which a child could be attracted to is not acceptable as a flavor. The same applies to packaging and branding on e-liquid products and disposable vape products. Vaprite retail locations are not selected to be near schools, as we don't sell to school children. We position ourselves to be easily accessible to our adult customers. We are not opposed to a restriction on the proximity of a retail outlet selling vape and tobacco products to be at least 500 meters from a school. I will now address certain proposals in the draft bill, as well as various other issues that were raised by the committee during previous presentations. However, my overriding message is that electronic delivery systems do not belong in the same bill as tobacco, or to be governed by the same regulations as tobacco. Other than the commonality of nicotine, they are distinctly different industries. As Vaprite, we support regulation of this industry. The Department of Health should be embracing this industry for the harm reduction aspect. Vaprite does not support the proposed legislation whereby products would need to be concealed from consumers. A vape store only sells vape products. How do we conceal everything in our store? How do we educate customers as technology improves and new products come to market? This is a perfect example of why vape products and tobacco products should be regulated separately. Cigarettes will always be cigarettes. They all look roughly the same, and the only real distinguishing aspect is the strength of the nicotine and a possible menthol flavor. Vape product technology is constantly evolving. In the early days, vaping devices had crude metal, and this is an example. In the early days, vaping devices had crude metal coils to heat and vaporize the e-liquid. Trace elements of metal were found in the vapor. Within just a few years, the metal coil technology improved to where no metal trace was found in the vapor. Now the metal coils are being replaced by ceramic coils. This is just one small example of the massive leaps and bounds being made in vaping technology to make the product safer. Vaprite supports the banning of vending machines for tobacco and vape products, as these are often located in restaurants and golf clubs where anyone can purchase from them with no age verification. On the issue of visiting suitable foreign countries to study how they have effectively used vaping to significantly reduce smoking levels, I recommend that this committee visits Sweden as well as possibly the UK. I just caution you to be aware that developed countries like Sweden and the UK do not have 18 Rand packs of illicit cigarettes widely available for sale, as is the case in South Africa. Much of their success is due to their smokers being able to switch to vaping at comparable prices to smoking. This would not be the case in South Africa due to the huge price disparity between illicit cigarettes and vape products. I only have two more issues to address to give relevance as to why the illicit trade can and will flourish as vaping and smoking become more regulated. SAPRA is an entity falling under the Department of Health. Cannabis is governed by SAPRA. There are around 100 licenses that have been issued purely for cultivation for export, not for selling in South Africa. It is illegal to sell THC products and cannabis flower in South Africa. Yet there are estimated to be as many as 6,000 cannabis and THC retailers in South Africa. And SAPRA is fully aware of this. They are aware because some of these retailers have stores and kiosks in some of the most prestigious malls in the country. And the SAPRA CEO was recently quoted in various media articles as condemning it. Your committee must also be aware of this. So why is nothing being done about this? One company with at least 30 kiosks sells THC edibles. Sorry, give me 1 second. And apparently marijuana as well in many major shopping centers, using a membership system which, according to a 200,000 Rand legal opinion from our lawyers, is not legal. Another listed company has over 100 franchise cannabis stores, once again with many in major shopping malls, selling cannabis under a supposed SAPRA-approved clinical trial. Really? You walk in, show your ID, and walk out with cannabis. How is that a clinical trial? Lastly, there are cannabis shops using doctors to apply for Section 21 approvals from SAPRA for cannabis scripts. However, Section 21 is supposed to be for critically ill patients for whom normal medicine is no longer effective, not just for anyone. So how are there over 6,000 illegal cannabis retailers in South Africa operating under the watch of the Department of Health, SAPRA and SAPS? How will the Department of Health protect legal vape retailers from similar illegality and criminality when we must abide by the laws of the country, but for those who choose not to, there are no implications? And finally, I'm currently sitting in Dubai attending the world's largest vape convention and expo. We met with a Malaysian company today, which is the largest supplier of disposable vape products in South Africa, with estimates that they may have a turnover equivalent to that of the next 10 largest companies combined. They appeared from nowhere less than 3 years ago and now dwarf their nearest competitors. When discussing the issue of the proposed tobacco bill with them, they are not at all concerned. Their director of sales for Africa told us that wherever vape products have been banned or had major restrictions placed on them, such as Australia, Sri Lanka, Malaysia, and Thailand, the illicit market has grown to up to 3 times what it was before the ban. His reasoning is that the ban makes the product worth that much more with huge profit margins. It appears that they are rubbing their hands in glee at the prospect of this bill being introduced, and there can only be one reason why. I therefore caution this committee, as you may just be setting up the vaping industry for an illicit trade comparable or greater to that which the tobacco industry is currently experiencing. This would result in unlimited access to vape products for anyone, including children. So that concludes my presentation.
Yes, Mr. Perry Buchman. You said you're a former pilot. You're still flying people now, or you stopped?
No, I've stopped, Chair.
Okay. Must give me your license, please. Thank you very much. Honorable members, here is the presentation. I would like to recognize the hands from honorable members. And I got my first one from Honorable Van Staden. Number 1. Keep your numbers, honorable members. Number 2 will be Honorable Shabangu. The third one is Honorable Dr. Leroux. The fourth one is Honorable Kumalo. Keep your numbers, honorable members. The next one, number 5, Honorable Zungula. Number 6, Honorable Mutubatse. Then 7 one is Honorable Sine. Okay. No other takers. Okay. I'll take one round, honorable members. So I take it that the members on the platform whose hands have not been raised or are not shouting, me too, are not asking questions. All right. Start, Honorable Van Staden, 2, Shabangu, 3, Dr. Leroux, 4, Kumalo, 5, Zungula, 5, 6, Mutubase, and Lassene, one after the other. I won't come in
Excuse me,
between.
Chair. Excuse me, Chair.
Yes, excuse
My
you.
phone was frozen. It's Tego. I failed to raise the hand, Chair. My
Okay.
apologies.
I
I'm
recognize
indicating
your
to speak.
voice.
Yes. Yes,
Okay,
Chair.
you're number 8. Thank you very much. Okay. Start.
Thank you, Chairperson. Good afternoon to all the colleagues and to Mr. Buchman. Thank you also for your presentation. I hope I'm audible enough. I've got some problems with my network. Some people have an opinion that a retail display ban would in effect criminalize a portion of a retail sector. If it indeed is also your opinion, what impact will a retail display ban have on your business and on the vaping industry in a whole? That's my first question. My second question is, how many retailers in your industry will be forced out of business when this bill come into effect? My third question is, you were also speaking about separate legislation, that vaping must be under a separate legislation rather than with a legislation like we have in front of us now. I want to hear from you, what is the reason why you're advocating also for this, that it must be separated in separate legislation? And then there's my fourth question is, there's always you've said it also now, I think in your presentation also now, you mentioned that vaping is better than smoking and better than tobacco. But then I'm playing devil's advocate now, yeah. And on the other hand, you also see sometime in newspapers the articles on people's landing in hospital due to vaping and all that sort of stuff, and it's on social media as well. I just want to know, and you've touched a bit on it, but I want to know if you can elaborate a bit more on it. If you have done scientific studies, or let's say have done scientific studies on this to show it that it is indeed better to vape than it is better to smoke. So have you consulted with scientists over a few years to collect this evidence and so forth? And then I just want to know, what impact, according to you, will this new legislation have on the country's economy? We've also touched on the illicit trade in the tobacco market, and some people believe that it will worsen under this new legislation. I want to know what impact will it, if you agree with that, what impact it also will have on your industry. And then second last question, does this bill have any benefits for public health, and do you think that this bill will be difficult to enforce, and if so, why? And my last question is, are you willing to work with the Department of Health and Government to form a separate legislation like you have been advocating for? Thank you, Chairperson.
Good evening, Chairperson and other honorable members, and the presenter of that has just presented to us. I also want to appreciate this opportunity to get this presentation. We are learning every day. Chair, the presenter mentioned that he is in support of this bill protecting children from accessing the products, but he does not elaborate on how. And also, if you say you oppose the product being regulated under the same law, how would you ensure that you protect the children? Because and with this bill, we also would want to protect the children from smoking. So if you oppose the regulation of the bill under the same law, the pure product under the same law, how would you ensure that to protect the children? You also mentioned that you visited Sweden, which is one of the countries which regulated the tobacco and the vapes under one law in 2018. Some of these countries include Canada and many more. Have you therefore identified any problem with those countries? As you mentioned that you visited Sweden, have you identified any problem for them in their approach of regulating of the tobacco and vapes under one law? If maybe you can explain to this portfolio committee if there is a problem that you have identified with those countries. Thank you, Chairperson. Those are the two questions that I had.
Dr. Leroux, come on.
My apologies, Chair. I was struggling to find the right button. Thank you to the presenter and for Mr. Buchman for his interesting presentation. And thank you for bringing those issues to our attention. I just had a few questions around your presentation. One of the things that you mentioned right at the start was that you do have concerns that if this legislation goes through, your company that is trying to sell vapes in an ethical manner is likely to go out of business. And what aspect of the bill is putting your business at risk? Secondly, in terms of the illicit vaping that is happening, are you, when you say illicit vaping, that's being vapes that are being sold at the moment, does that refer to vapes that do not have excise duty on them, I don't have taxes on them, or and what would you say? What is your estimation of how much is currently illicit versus legal, and is on which excise duty is being paid? Could you perhaps just illustrate the difference between the vapes that you sell and the vapes that, how the approach at BP or a spa versus what your approach? I understand that some of it would be around age, that you use, even though there's no law on this at the moment, that you do not sell to under 18s. Is that part of it, or is there anything more around that? And then if you could give us an idea of the price difference between the multi-use vaping devices versus the single-use vaping devices. And I mean, yeah, and of course I understand there's the environmental aspect of it, but also the it obviously makes vaping much more accessible to teenagers if it's cheaper. So I assume that's part of the reason why you are against the single vaping. But if you can give us an idea of those, please. That's it from me. Thank you very much.
Thank you very much, Chairperson. Let me also join my colleagues for accepting the presentation from the presenter. But Chair, I'm just having two questions that I want clarity on. One, the presenter Chair have suggested that vape products should be made affordable than smoking products. So my question is, Chair, why should a public health bill promote addiction to products that are not scientifically proven to have health benefits? Lastly, Chair, since the presenter have said the vape and tobacco industry are two distinct industries, can he name any big tobacco company that is not manufacturing vapes? Thank you, Chair.
Thank you. Evening to the colleagues, Chairperson and Mr. Berry. I've got a couple of questions. Firstly, Mr. Berry, thank you for coming to present. Are your assertions based on science? Because you find that many people come to the committee present, but they'll present things that they are perceptions on their view. They're not based on any form of science. Would you confidently say your assertions are based on science to say that if a person were to make a decision, if a smoker were to make a decision, it would be better for the smoker to move from smoking cigarettes and move towards vaping, which is less harmful. That's the first one. And if a non-smoker were to make a decision, you would advise that they must not smoke at all. But if they were to smoke, a less harmful product would be vaping or pouches or any of those products. So the question I have there is that based on science or what is it based on? Secondly, if the bill were to be passed as it is now, do you think that that would make the illicit market or illicit trade to be further worsened and then make the strain on public health to be much more worse than ordinarily what it should be? Then the other question is, if the bill bans single use of vapes, will that help poor smokers given the high price of retail systems? With regards to the typical bottles for liquid are 60, 120, and 200 milliliters at 3 rands 19 cents. Are there any of those prohibitive? Also, how is the banning of disposables going to solve the illicit problem? Are we not going to still see illicit trade in these product categories? And is it not going indirectly to encourage unsafe use of vapes, which is targeting the kids if the disposables are banned? And also, in your estimation, who is responsible for the selling of vapes to young kids as it is now at the moment? I hope my questions are clear. Thank you so much.
Thanks very much, Chair, for the opportunity, and also thanks for the presentation. In your opening, you said that you're not sure if you'll live to make a profit if this bill goes through. Why are you saying that? And secondly, I think members have covered this issue of banning, because banning in itself has unintended consequences. And the objective of this bill is to control. Now, most of the advocates of vaping want to put it as not a health hazard. Now, the intention of this bill at some point speaks to the control and the demarcation. Would you advocate that when we talk about the control and the demarcation, therefore yourselves will promote vaping anywhere in any establishment where one gets into? Will you advocate for that? And just to say, one member of the public during the hearings was advocating that perhaps maybe because business has failed over the years to control selling to young kids, perhaps we should consider issuing licenses to individuals who are to buy, and also put the limit as to how many one must purchase, because if you don't do that, you are promoting overbuying, and because you are advocating for health, that might be able to assist in the control of health. What is your take on such a statement whereby individuals will have to be issued with licenses to buy vaping? Thank you, Chairperson.
Thank you very much, Chairperson, and good evening to everyone in the platform. Chair, my first question, the presenter, all of your recommendations about how vapes should be regulated are contained in the current bill. Given the cost of policy making and the very close similarities in the use, manufacturers and also target population as described in your presentation, since you said you are targeting smokers, why would you recommend that the government go through this whole process for a new product that has been introduced into the market? Does that mean that whenever the industry or a similar industry makes new products in the future, we have to create a new law for them as well? And number two, Chair, the presenter, you mentioned that tobacco is currently not socially acceptable. I hope you know that this was not always the case. There were times in our country when if you were a smoker, you were more respected, and young people wanted to smoke tobacco to be like adults whom they admire. We don't know if this will be the case about vapes in the future, if tomorrow more information about the health harms is discovered. What would be your comment on this? Thank you, Chair.
Honorable Peko, she disappeared.
I am here, Chair. It was the problem of my phone freezing. I am here connected, Chairperson. Good evening to you, the presenter, and the honorable members in the platform. Chair, my apologies for the delay. To the presenter, let's appreciate that he is here with us making such a presentation. I have some comments to make, Chair. Some will be comments and few questions. To the presenter, I am trying to understand, because he is suggesting that vape products be made affordable than smoking products. Am I wrong if I conclude by saying he is promoting his own products against tobacco products. Also to say, does that recommendation not lead to vape products being more attractive to younger ones if they are made to be affordable? He is also saying they are not selling to school children. Is that the case, Chair, when most vape shops are found near universities and schools recently? That's what I have just established, that there are more vape shops near universities, which I think that is really attracting the young ones. Also to the presenter, I would say, if he says vape products are not causing harm, can he recommend those products to his own family and children if they do not cause harm? To me, I think vape products also contain nicotine. That nicotine can cause harm. If it can cause harm, that is the same as tobacco products. And my complete statement would be to say, two wrongs do not make a right, because in his statement, he is saying we may be, by banning this or by regulating this industry, we are promoting illicit trading, which is not the case. But I don't think it is correct to always fight the introduction of these regulations, citing the issue of illicit trading. Illicit trading is a challenge also, but the Department of Health is not the only player in that field. SARS is there, SAPS is there, everyone must play his or her own role to fight illicit trading. We are also against illicit trading because those people are selling illegally. Also, Chair, if he says 46 years ago he was smoking, and now he is on vaping, when he was smoking, that also attracted younger ones and non-smokers, because an adult sometimes is a role player to others. That is also going to happen regarding these vape products, because if a younger one sees me vaping, he will say, if that mama is vaping, let me vape also. I think, Chair, the issue of harm is harm, less or otherwise, but harm is harm. If tobacco products are seen to be harmful, even vapes are harmful. In tobacco, we say there's nicotine. There's nicotine also in the vape products. And that nicotine that is there, I think it should be prescribed by a doctor. That's why it is dangerous to sell to anyone without a prescription. That's my take, Chef. Thank you very much.
Okay, I noticed that there are two more hands that came up after we've taken the list. I take it that honorable members had the challenges with their gadgets. Honorable Tetale Tlape, you then will be followed by Honorable Mare. Honorable Tetale Tlape. Dr. Letlape, are you available? This is your space now. Honorable Mare, come through. Thank you.
Can you hear me now, Chair?
Yes, I can hear you now. Thank you. Come.
Okay, thank you. My first question is about the environmental impact of non-disposable vapes, because they have components that are not reusable, the cartridges, for example. What are you doing in your company? Are you offering any recycling in your company? I understand the massive impact of disposable vapes because it's the whole contraption, which should be the battery, the nicotine container, etc. But even the non-disposable vapes have an impact on the environment. What is your company doing about that? The second question is, do you have any suggestions on how we curb youth uptake? Because that is the major issue globally that people worry about. And in terms of displays, what are your thoughts about displays being allowed only inside the store, and the stores being specialized stores that are licensed, and the employees need to be trained in terms of what they are offering? So the issue of counseling, appropriate use, etc., should be something that gets done as well. Lastly, what are your comments on advertising? Because we've got to find a media where it can be product advertising. And I understand when people talk about new technologies, etc. But if we focus on people who smoke, there could be mechanisms of reaching those without reaching the others who don't smoke or youth. What would be your suggestion with regard to that? Thank you, Chair.
The last hand is Honorable Mare.
Thank you so much, Chairperson. Greetings to everyone on the group here, and I want to say thank you for the presenter. The question that I would like to ask, I was listening to the presenter, and I just want to know, can you get addicted to vaping? Because you see a lot of children, and even though the gentleman said that, you know what, the health risk is not so much, I just would like to know exactly what is the health risk about this. Because you see, before the vaping, there was this oka pipe, and then the children will give it from the one to the other one, and it will go around the group. But I see the same thing is happening to the to this vaping thing. The children will walk down the street on the way to school, and the one will give it to the other one, from the one mouth to the other one. I just want to know, is there any health risk concern this thing? Because I know with the Oka pipe, a lot of children got infections in the mouths because of this pipe that they used to use. I just want to know what is the health risk on that. And it is true what the gentleman is saying, that you see on TikTok and all the social media about how the lungs of these people are collapsing. Did anyone do a health analyst to see if this thing is really addictive? Is this thing collapsing the lungs? What is really the thing of this vapes? And I want to understand, what is the difference between a rechargeable vape and the one that you can throw away? The reason why I'm asking this is because I have a daughter and a son, and these two is using this vape thingies. And then you will see when you want to charge your phone, this thing is on the phone, is on the charger, So I want to know, is there a difference? Because how can you charge something and then smoke it, and it's like there's nothing wrong? I need to understand, because I'm not a smoker. I don't know what it is to smoke a cigarette or anything. That is the one thing that I also would like to know. The gentleman was saying that the edible shops that is available everywhere, and everyone knows about it. But in that very edible shops, these people are selling these vapes at these shops. What are the presenters saying about that? Because it seems like the vape is the in thing. And then the thing I also would like to understand, Chairperson, is that these illicit cigarettes are cheaper than the normal prices. Is it a sign that the tobacco companies are overcharging the people for cigarettes? Because we're not just having a problem with illicit cigarettes, we have a problem with counterfeit goods where people are spending millions of rands, and when SAPS and the police go and raid these places, they take millions of rands of counterfeit goods, Johannesburg or Durban, wherever the case may be. So this is not just a cigarette problem, it is a national problem where we steal with counterfeit things. And it's coming illegally into the country and it's been sold in the country. So yeah, I might be asking the question, is the tobacco company then overcharging? Because how come you get a place that is selling cheaper cigarettes, and is it cheaper cigarettes more harmful to the people than the ordinary prices of cigarettes? The last question I want to ask, Chairperson, is that every year you will see during January, December, and February, you will see in Cape Town there will be fires in the mountain, and you will hear the presenter on TV say that someone threw a cigarette on the ground and it started this fire, because you know that Cape Town is known for the winds. So I want to know if this vape gets extremely hot, say it's lying in the sun for a few days, can that vape start a fire when it gets extreme heat, or is it just finished when it's there? It must have started somehow. I just need to understand that. But my main concern is this: that it's true what the gentleman is saying, is that these edible shops is everywhere. And I have a concern because I'm in Department of Social Development, and I spoke to the minister and everyone about this thing. It is sweets that they're selling, jelly tots and all different types of sweets that you can't even recognize it is cannabis. And for that sweets to go to schools is going to be a massive disaster. So I want to agree on that one thing what the gentleman was saying, but I just need to understand these vapes, what health risk is it having to the people and the children? Because it's more like a fashionable thing, walking down the street, blowing this thing like it is now. You are more expensive because you're not smoking a cigarette, it is like the thing that the children are doing now. But then they are also exchanging it to one another as they are going along. Thank you so much, Chairperson.
Okay, thank you very much. On my side, Mr. Perry, I just wanted to add on what my colleagues have asked. You said in your presentation that you are now tobacco free for 10 years. I suppose you mean you are not using cigarettes, but you are on vapes. But the bottom line is that you are still a nicotine user. So to complete that sentence, that there is, in fact, I would end with that part to say there is still nicotine in the vape too. I actually note your comment to say, can we maybe have a regulation that talks about nicotine strength reduced from 5 to 3%? I would imagine those who would be really interested to see that happening will welcome that suggestion. I was happy when I heard you say ban all single-use disposable vapes. And you have added something that was actually very important to me, massive harm to the environment. Since we started this meeting, I have then since made a contact with the chairperson of the portfolio committee on fisheries, forestry, and environment, because I think I need to speak to her with regards to your contribution. I would have wanted you to go on further to say you also want to ban the good flavors, because if it is fair, somebody educated me that nicotine is not a bad taste, not a good taste. Therefore, you want to cover it with what is currently there, menthol and mint. Why would you want to go grapes, vanilla, strawberry, unless you are really going for a younger market? And in fact, somebody presented last week to us that since we allowed the pressure of young people asking for flavored condoms, so too we should allow for flavored vapes, because it's almost, he was actually using that similarity. Immediately you are saying to you want to keep vapes that are mint and menthol. somebody would like to agree with you, but once you want to go to grape, vanilla, strawberry, we are definitely attracting another population that has never been there. So I would have thought, I would really support some of the things, but this issue of vapes having these flavors is a real big problem. Let us accept, Mr. Perry, what we already have, because the Health Act is a composite act that has got too many programs, and I don't think we should really make the statement that you made, because we can't be able to regulate all nicotine products under this bill with some level of differentiation. I mean, whether vapes or tobacco or cigarette, there's nicotine there. So the common denominator both is that there's nicotine. So you just have to have a level of differentiation. So we can't. In fact, there are some of the people who came in, like yourself, to say, please regulate us. We are operating very freely, and sometimes we know we are not doing well. So we can't delay, because Mr. Perry said, let's go and separate and have a different bill for tobacco products and different ones for vapes. We'll not get there. The common denominator here is nicotine. And then the industry, we want to support the industry to start operating within the law. So let's just remove this notion that we should have had this. And I mean, the Health Act, as an example, is a program. It has got multiple programs. We can't say, no, the Health Act should have had one dealing with cancer and another Health Act dealing with HIV, another Health Act dealing with the training of healthcare professionals, all in one umbrella. So this is a very minute process we are talking about, combining tobacco products and electronic delivery systems. Not going to be possible to separate. You might have wished that, but it's going to delay the process, and it's unnecessarily so. And there's not too many people who would agree with that type of a viewpoint. Can you assist us then with your responses on these points? Thank you very much.
Thank you, Dr. Lomo. Now, unfortunately, these questions have taken longer than my actual presentation, which would be impossible to answer everything. We've actually already 2 minutes away from the end of my presentation allocation, including answers. And there are a lot of questions here. I've got 4 pages, which unfortunately there's simply no way to address. So I'm going to try and run backwards, just with the ones that are fresher in my mind, although I have used a program to record all the questions so I could look at them. So the first thing I'd like to address is the issue of nicotine and the misconception that nicotine is bad for you. Nicotine is addictive. It's common in cigarettes and it's common in vapes, and it's addictive, but it is not bad for you. The fact is that almost all of you have consumed nicotine at some point in the last month. All of you. Because the trace elements are even found in some vegetables. So nicotine itself is not harmful. People think that it's nicotine that's killing people. It's not. It's the combustion, it's the cigarette smoke, it's the tar, it's the carbon monoxide, and it's the carcinogens found in cigarette smoke. And the same goes for the hookah that the one lady mentioned. It's the combustion that kills people. It's the combustion that causes smokers to have a hoarse voice. It's the combustion that results in people getting diseases that cause death. So I really need to dispel this. And I also did have a disclaimer when I started off saying that I'm not a scientist and I'm not a doctor. You have 2 very qualified doctors on your committee. There are a lot of questions here that you addressed to me that just from a medical standpoint, both those doctors could give you the medical their medical opinion on these issues that have to do with it. And additionally, Kurt Yeager also addressed certain issues. He has a lot of research material available that the committee could ask for, but I'm not a medical doctor, I'm not a scientist. Some of these questions that have been asked of me, I'm a businessman and I'm a pilot. If you ask me about flying, I can tell you how an airplane stays airborne. But when it comes to the science, I cannot tell you, but there are certain things I can tell you. So, Dr. Lomo, I'm going to go back to your question about flavors. If you see the customers walking into our shops, firstly, as I said, they're all adults. We have customers who are in their 60s and 70s walking in, and they all use flavors. The problem is you need to distinguish between children who may vape, and they have certain flavors that might attract them, whatever that might be. But the fact is that every single adult who has made the conscious decision to stop smoking and start vaping because of the lack of harm reduction, they use flavors to keep themselves there. They don't want tobacco, they don't want mint. The fact is, you could take alcohol then and use the same thing. Why don't you just have a plain version of alcohol and not have all the flavors in it? You know how bad alcohol is. So as far as nicotine goes, I mean, as far as flavors go, this argument of saying that it's targeting children, that you shouldn't have it for adults, all that you will have is you will have all these adults. If you give them vape flavors, or you take the flavors away, they will go back to smoking. They've got no reason to use vapes because it will be unpleasant. They're not just going to stop, they will go back to smoking. So you're just going to be reversing the harm. Okay, then I was asked, I've been tobacco free for 10 years. It's actually 12 years, yet I'm still using nicotine. I believe I answered that when I gave the explanation that yes, I use nicotine. I'm addicted to nicotine. I have the business and I do test samples. So I'm using nicotine all the time. But the fact is, if I sell my business one day, I will be able to stop. It's not that difficult. I've done it before where I had to. I stopped nicotine once for 2 weeks because I had to. I'm not going to say why, but I had to just stop for 2 weeks. And it wasn't difficult to do. Harm from vapes for children. That's another question I've got. From vapes for children. Okay, so we're talking about children again and potential harm. And someone asked me a question, very relevant question. They said, yes, I've got 2 children. I've got a daughter that's 23 and I've got a son that's 21. And my son, when he was at boarding school in Grahamstown, I found out that my son was smoking cigarettes and smoking marijuana at the age of 16. So I made the conscious decision to give him vapes on the condition that he stopped smoking combustible cigarettes and he stopped smoking combustible marijuana. And I can tell you, I'm not the only parent that's had this dilemma. My son today, he still vapes, but he doesn't use marijuana, he doesn't smoke cigarettes. And he hasn't since I put him on vaping. So it's 2 huge evils versus something I don't see as being too evil. Yes, at some point he's going to have to stop, but he's no longer using combustible products. So yes, I made the conscious decision as an adult to get my child off. And I happen to know a very senior official in the Department of Health who I had a conversation with, not on this platform, who admitted to me she was having the same problem with her son as well. So it's not something that's unique to myself, or it's very prevalent. Okay, can vapes cause fire? Vapes cannot cause fire. A vape product is it has a battery inside of it. It's not something that has ignition. So it does heat a coil. The way in the beginning, and I was once again talking about the safety of vape products and how they've evolved. Way in the beginning, vape products had very big batteries. There were even products called MechMods, which were very dangerous. And there were situations where a vape battery actually overheated and it caught fire. But this industry has evolved so much. Vape products have become much smaller, the vape devices. No, they cannot cause it. Now, what I'd like to do is take the opportunity. I said I would show everyone the difference between a single-use disposable and a vape that is not a single-use disposable. So what I'm holding here is a single-use disposable. This is a device that has a battery, and when this product is finished, which on something like this, I'm not even sure how much e-liquid it holds, this is thrown away. You cannot recharge it. And even if you could recharge it, when it's empty, you throw it away. And inside here, the bottom half of this device is a battery. This device will last 1 to 2 days. Then you throw this device away with the battery. What I'm showing you now is what's known as, it's a rechargeable device, but it's not a single use, because what happens is, this is the battery. When this is empty, you throw this away. This is just plastic. It's nothing else. Once the liquid's gone, there's plastic inside here, and there's a very small coil. And this can be recycled. This will be reused and reused and reused for 1, 2, 3 years. This is the battery. It never gets thrown away. The other thing about something like this, you have a child. Which one's easier to hide? This, I mean, look at the size compared to my hand. Gone. Easy to hide. Take a look at this one. You're not going to hide that so easily. And additionally, this is going to be a lot more expensive. This sells for about 90 Rand. This, as a kit, will sell somewhere around 250 Rand. Also not that affordable for kids that are maybe clubbing together and buying vapes. Then another question that I want to get to was the issue of the TikTok videos, and I think this is very relevant. We have people like Dr. Van Zyl Slabbert in Cape Town starting to bring up popcorn lung again. Popcorn lung has never happened to anyone vaping. There was an ingredient way in the beginning that was in the vanilla flavor that was known to cause popcorn lung. That disappeared so long ago, and nobody has ever got popcorn lung from vaping. So you see these videos on TikTok, and it shows people, and they say, "Oh, I was vaping, and my lungs filled with liquid," or "This one was vaping, and she's dying," whatever. And you know what always comes out? Like Ivali. They are using cannabis vapes. Our industry is not a cannabis vaping industry, it's a nicotine vaping industry. So vitamin E acetate was used to thicken those cannabis vapes in America. And wherever you see someone on TikTok claiming that they got sick, they were either former cigarette smokers, but primarily they're marijuana users. And whenever someone goes back, you find out this person was actually a drug addict. They were using marijuana. So it's not, vapes are not making people sick. And I previously said that I've had over 100,000 customers in my business come through our doors and buy from us. If you went to a restaurant and you had a bad meal, you'd go and tell the restaurant owner. Do you think people wouldn't come back to us and say, "I bought a vape, I'm getting sick"? Never had it happen. Over 100,000 customers. Cigarette companies overcharging. Cigarette companies are not overcharging. The fact is, the illicit trade is not paying the excise tax. You can buy a pack of cigarettes from the illicit trade for less than the excise tax. So cigarette companies are not charging a lot for cigarettes, but in my opinion, that excise tax should be way more, because cigarettes are cheap in this country, and that's why we will struggle to be able to compete with the success in Europe. Because in a place like the UK, a pack of cigarettes costs £15. In South Africa, you can buy an illicit pack of cigarettes for $1. So vapes are less expensive, or comparably the same price in the UK as cigarettes. So it's easy to make the decision to switch from one to the other. But in South Africa, that's not the case. When you're competing with an 18 Rand pack of cigarettes, we can't compete. Our excise tax alone, what Treasury did to the vaping industry, has already put us under serious financial pressure. It is a ridiculous level of taxation where they took e-liquid and the tax exceeds what we were selling the e-liquid for in the first place. Now I'm going to go back to the beginning and see if I can address some of the other questions. Just give me 1 second. Okay, the retail display ban. How would that affect us? So I do understand where this comes from. And this is also another reason that I've said, and Dr. Lomo, I'm responding to something that you said, where you're saying, why should we separate the vaping industry from the cigarette industry? A retail display ban on the cigarette industry won't have much of an effect. People know what brand they smoke. They know what cigarettes are. They're simple products. They're going to walk up to their local supermarket and they're going to say, okay, give me a pack of this or give me a pack of that. It's a simple thing. But when it comes to vape shops, and I believe another question also is related to this, where if we have dedicated vape shops. From our side, a lot of them are within shopping malls, inside brick and mortar. It's a secure area. So let's say the committee decides, okay, cover your windows. Put a cover over your windows so that children cannot see inside. That's fine with us. But don't tell us to hide our vape products, because how are we able to educate if people come in and there are new products and safer products and maybe new technologies and safer technologies? How are we able to educate people if they walk in and they can't see what we have? We're not allowed to advertise. We're not allowed to educate. How do we sell our products? So that also comes back to the question that someone else had, and I'm just trying to combine my answer with certain things, is why do you say that you're going to go out of business? What, that this is going to affect you? So I can tell you that the excise tax alone has put serious pressure on us, and it has grown the illicit market. I gave you an example of how the illicit market's affecting us. And our turnover as Vaperite, we're the largest vape company in South Africa, is down 10% from last year. And the main reason is because we simply cannot compete with the illicit market in the way it's growing. And people are moving away from regular vape products, and they're going to disposables for the ease of access. And we're not able to compete on disposables because we are a legally compliant company that imports our products and pays our excise tax. And we pay our VAT and we pay our company tax, and other people are not doing it. So that is so my issue on the fact that you're saying hide it. I understand. You're going to a Spar, Pick and Pay, a Checkers, and a kid's walking with their family and they go past the cigarette counter. Yes, they see the cigarettes, they see the vapes. But those children are not in my vape shops. So why should we be forced to hide our products? As far as the separate legislation, I do understand it creates predicament for this committee, specifically for those who would like to see this bill going through very quickly. But you wouldn't legislate motorbikes and motor cars under the same legislation as far as seatbelts are concerned, because there are no seatbelts. It's a different level of danger. It's a different level of use. There are many examples that one could give as to why vaping is just so different to cigarettes, and the primary reason is combustion. Okay, so I've addressed the issue once again of people landing in hospital, where there are articles about people landing in hospital from vaping. They weren't vaping regular vapes. This also goes back to the illicit trade. We have an ISO 7 laboratory. I'd actually love to share the picture of our laboratory where you can see how we work in our laboratory and the level of cleanliness that we use. Illicit vapes, there's no quality control. There's no knowing where the ingredients came from. It's so all those people getting sick, they're either getting sick from marijuana vapes or they're getting sick from something that's made in someone's garage. Dr. Letlape asked about what we are doing for the environment as far as environment is concerned. So Vaprite is registered with SAWIC. Our PLO, or I think it's PRO PLO, is Iwasa. You go to any Vaprite shop, there's a bin which encourages people to return their disposable vapes. And we are doing as much as we can. We obviously cannot force someone to return their disposable vape to a Vaprite shop or to dispose of it properly. If you take the illicit market and you take the kids, first thing they're going to do is try to get rid of their vape as quickly as possible. So it's a huge problem. And I really appreciate, Dr. Dloma, that you've been proactive on this and you've contacted DFFE, because this is a major issue to me. I live at the coast. I've got nowhere to dispose of anything like a battery, and plenty of other people are in the same predicaments. And to be honest, I'm using them because I'm sampling them, but there are plenty of common users, and it's a major issue for the environment. You're not taking anyone's rights away by getting rid of single-use disposables. There are plenty of other options. It's actually going to be less expensive for someone to use a more environmentally friendly option. But what you are going to do is you're going to take the very cheap ones away from the very outlets that are selling to kids. Somebody else asked me, where are the children getting their vapes from? I'll tell you where the children are getting their vapes from. They're getting it from FMCG retailers. I'm not going to mention individual brands, but they're getting it from supermarkets. They're walking up to the cigarette aisle. There's no legal obligation for those people to check for IDs, because there's no legal age limit. And I've implored you to please act on the age limit immediately. It can be done outside of this bill. You will have our full support. They're getting it from forecourts. They're getting it from petrol stations. They're getting it from China malls. They're getting it from all these little stores, convenience stores, cafes, as you like to call them. There are plenty of sources for them to get these vapes. Very easy. The same way we used to get cigarettes when we were children. And I'm sure you're all fully aware that the majority of people that actually smoke cigarettes started before they were 18. I think it's 90%. The other problem you have is when you tell children not to vape, when you keep pushing this so hard and you say, don't vape, don't vape, don't vape, it's like holding up a red flag to a bull. They're going to say, oh, what is this thing that they don't want me to do? What are children going to do? They're curious. So it's a huge problem. And if children who are vaping weren't vaping, they'd be smoking cigarettes. So it's actually an ethical dilemma. And I personally don't know how to answer it. And I don't think anyone else here can. You will not stop children doing what they want to do. Tell them not to do it. They will do it. They will find a way to do it. So we have a problem. But maybe someone else asked, how do we get the poorest of the poor, give them the option of converting to vaping from smoking? How do we get people who are smoking to start vaping? And how do we get vapers potentially to quit? And unfortunately, that potentially takes the excise tax that we're paying being diverted into clinics so that we can actually, like the UK did, I don't want to quote the UK program, but this is something that you as a committee could investigate. I believe the UK gave over 1 million smokers vapes to get them off smoking. I don't want to quote the number, but there was a program, and I might be way off on the figure, but I believe the UK did something like that, and that's what this industry needs to do, and that's what this committee and the Department of Health need to do. Investigate. Use the doctors on your committee to get a real, genuine medical opinion on harm reduction, and at least stop people from dying from something. Get them off combustible products and get them onto non-combustible products where people are not dying.
You have 5 minutes to.
I know, Chair, and that's what I say. I mean, I've got 4 pages here. So I'm going to see if there's anything. Okay, risks for business with our new bill, with a new bill. I can tell you now, a flavor ban, and I'm out of business. You're going to shut down the legal vape industry. All you're going to have left is an illicit trade, and then you've lost control. You've got no control over product that's going to be coming into this country. You've got no control over cigarettes. I've shown you that you've got no control over the cannabis industry. You're going to have no control over the illicit trade. If you ban flavors, adults will either go back to smoking, or you're going to have an illicit trade. They're actually going to get their products. You can go to Australia right now, where only pharmacies are supposed to dispense vape products. Okay, you can go into any store there, any store, and behind the counter they're going to have vape products. It's just not the way to deal with things. And flavors are essential to keeping adults motivated to stay off returning to cigarettes. It is very easy to go back to cigarettes. As I said, I can choose anything I want. I don't have a limit. I have my particular flavors, and these flavors have driven me and kept me off returning to smoking cigarettes for 12 years. Size of the illegal market, I think you'd be very surprised. I think you'd be very surprised. I have no figures. And you talk about SARS, you talk about SAPs and getting them involved. I have tried to advise SAPs and SARS about companies I suspect of being illicit, and I get absolutely no feedback. It's like I'm wasting my time. It's so really, it's never going to happen. It's never going to happen. It requires a task team. If you cannot control the illicit cigarette trade, you're never going to control okay, illicit cigarettes is a lot easier. They just walk them over the border. And in fact, most of it's is actually made in South Africa. You're just going to have no control. So I really believe that this needs workshops potentially. And someone actually asked about our industry potentially working with the portfolio committee or creating a workshop. And I really believe that's what's needed. You need to take people like ourselves who are genuinely not selling to children, and who really believe in what the vape product is. Let's get the science from the right people. Let's get the certain medical doctors involved. And it's not about saying, is vaping on its own good or bad? It's about saying vaping versus smoking. One kills, one doesn't. So yes, I'd be more than happy to work with you through Vipasa. Of course, I am a board member of Vipasa, but I'm not representing Vipasa today. But we would happily and proactively assist in putting together programs to facilitate that. Separate legislation, maybe separate. One question was about Sweden and that I'd visited Sweden. I have not visited Sweden. I've simply closely followed Kurt Yeo and the research he's done, the very good work he's done, the facts that he has. And he educated me on what's going on in Sweden. So I simply say that Sweden has the most successful harm reduction model in the world. They've reduced, I believe their smoking rate is now approaching 4% amongst adults, which is phenomenal. And they've done that by using harm reduction. So no, I haven't visited Sweden, but I do recommend that the committee potentially visits Sweden and possibly even the UK. Chair, I know I've missed a ton of questions. I mean, as you can see, I've got pages and pages. Is there anything specific? I know my time's run out now. Is there anything specific that anyone has that urgently needs to be addressed? Or alternatively, you're more than welcome to email me. Anyone that has a question that they really feel needs to be addressed, I'm more than happy to answer by email.
There won't be new questions, Perry, but if there are issues that we have not completed to answer, please write them back to us, okay?
Okay, I'll do that, Dr. Dlom.
Yeah. Okay. Thank you very much. Your presentation was just but one of many that we are still going to engage with. But we thank you for coming into this portfolio committee and presenting your case. And we have actually listened to you, and we will then use some of the things that you presented to us to assist us in fine-tuning what you have presented to us. Now, you are very persuasive. You say bicycle and a motor car, but one will tell you both of them are instruments to take me from point A to point B. So there's some commonality. Look at the denominator more than look at their differences. Okay. Thank you very much, Dr. Buckman. We'll meet you some other time. Thanks.
Thank you, committee.
We are now welcoming another presentation from Professor Marx. That I've been informed. Professor Marx, welcome with your team. You are a learned professor from some university of Stellenbosch. We'll give you this opportunity to brief us from now for another 30 minutes. And then thereafter, you will have to listen to the members asking you questions that you then come back and respond to them. For now, we'll allow you to start, and your 30 minutes starts now. Thank you very much. I can see your presentation is already on the platform.
Thank you, Dr. Dlomo. Can you hear me and can you see me? I think the light may not be good where I am.
If you can see your presentation, thank you.
Okay, all right. Okay, good evening, everyone, and thank you for welcoming me here. So yes, I'm attached to two universities, the University of Stellenbosch and the Australia National University. I do not represent their views in this presentation, but I am saying that those are my affiliated universities. And I'm also a social worker and health coach in private practice. And so my views are based not only on my academic work, but also on my practice work as a allied health professional and as a health coach. Just so that people understand where I'm coming from, I've been working in the field of harm reduction for over 10 years, mostly in the area of drug use. And so my involvement in tobacco harm reduction is much more recent, but it is a substance, and therefore I think it follows the same logic. And so I'm going to present in that light. I think, I wanted to begin with just talking about what harm reduction is, because I think it's a term that's been thrown around even today, but it hasn't been clarified. And I think it's only fair to just say what we mean when we talk about harm reduction. So there are many components of harm reduction. The first is that it prioritizes the well-being of the individual over and above the notion of abstinence. So it's saying, what does an individual need to be well? And that is the priority. We talk about it in harm reduction as meeting the person where they are at. The second thing about harm reduction is that it looks for practical solutions that reduce the negative health impacts of, it could be any form of substance, it could be driving badly, it could be, even if I think about it, it could be corporal punishment is harmful, right? So what do we do practically to reduce harms? And then it does allow for autonomy and choice. In other words, the individual has to be able to make their own decision, because if we impose decisions on people, we lose their ability to change. And then lastly, it really prioritizes the lived realities of people. So if we are to talk about what we do with tobacco, we've got to understand what it means for the people that are tobacco users. So how do we then understand this in relation to tobacco use? A couple of things, right? We have to understand firstly that tobacco, because of both the tobacco in this case, but the nicotine in particular, does create dependencies. And I'll get onto whether tobacco over the nicotine is harmful or not in a minute, right? And so because of that, there are physical withdrawals from nicotine and tobacco in this case, which need to be taken seriously. So there is that component. But we also have to understand why people smoke in the first place. And there are many, many reasons. It could be because it's sort of fashionable, and that came up in the last session. It could be because, it looks nice to people that are smoking. I'm not sure. But in many cases, it is a stress response. It allows people to manage their anxiety. And it is therefore also a coping mechanism. It allows for emotional regulation. You'll find many people that are smokers are dealing with a lot of stress, and they see a cigarette, and I heard this last night at a book launch, as a breathing space. I've also heard people in various forums with mental health problems, particularly ADHD, saying that without cigarettes, they are not coping at all, because it does have, a stimulant effect. So we need to understand the reasons for use in the first place. In the space of harm reduction, we always look at who is the most vulnerable, and that is who we focus on. And in the case of cigarette smoking, we need to say that many, many people that are still smoking cigarettes, perhaps the people that don't have access to the kinds of devices that were presented in the previous presentation, but also people who are undergoing much more stress than others, are marginalized groupings. I'm talking about, even if you walk on the street, you see homeless people, they're picking up the cigarette butts that have been left behind by other people. People from low income backgrounds dealing with a lot of stress. People with mental health problems. I've already spoken to that. So if we think about harm reduction in that light, we've got to understand that we are also trying to find solutions for marginal people who otherwise are not receiving the proper care and attention that they need, particularly in relation to health. So what does this look like if we say we are looking for less harmful solutions, which is what harm reduction is about? It's about saying, how do we reduce the harms associated, in this case, with tobacco smoking? And the one way to do that, as we do in other fields of substance use, is to say, what is the substitute? So if you say to a person that's smoking cigarettes, you say to them, what is it that you, in this case, addicted to? They'll say maybe both of these or one of these. They'll say, one, it's the nicotine, and two, it's the modality. In other words, the smoking. Some people will say one or the other, but we have to listen to what it is. But for the most part, people will be addicted to the nicotine. Whether or not the modality is part of it is a conversation you have with your individual person, your individual patient, if we're talking about a healthcare frame. So these are the kinds of ways that I would like to understand the transitioning. We get traditional smoking, cigarettes, very high health risks, and that's because of the carcinogenics that are associated with tobacco, right? We know that cigarettes are responsible for cancer, heart disease, stroke, chronic obstructive pulmonary disease, not the nicotine, but the tobacco. I'll get on to tobacco harms just now. And then we move to the possibility of nicotine replacements. So the patches, gums, lozenges, and all of that, which we've already had on the market for some time, they have not been terribly successful. And then we have safer alternatives, which are vapes, snus, which is the pouches that we put in our top lip, the non-combustible tobacco, because we've heard already from the previous speaker that the major harm of cigarettes is in the combusting. And we know that these alternatives are far safer because they have far less toxins. I will talk about nicotine in a minute and whether it is harmless or not. And so what that allows for, these safe alternatives, is for a gradual reduction in smoking cigarettes. And that is where the Swedish case has been referred to many times. It's not the only one. We see similar things in other parts of the world where a harm reduction approach has been taken to tobacco. But we do see that it does lead to cigarette cessation far more effectively than previous forms of nicotine replacement, which are on the market. So when we talk about the technologies of harm reduction, we're not just talking, by the way, about e-cigarettes or vapes. We're also talking about the oral nicotine pouches. We're talking about the heat not burn products, which prevent the combusting. So I wanted to put it out there so people understand that it's not simply just the vapes that we're talking about. There are more things. In this particular regulation, it's mainly focused on vapes, but we need to understand that nicotine replacement comes in various different forms. Now, there is a lot of evidence, and this is to the point of the previous presentation, people were asking about nicotine. What do we know about nicotine? We know from a range of different scientific research processes across the globe with various different methodologies that nicotine alone presents a substantially lower health risk than combustible tobacco. And we've seen how countries such as the UK, but not only the UK, therefore have supported the move towards pure nicotine rather than tobacco products that are combustible. So nicotine products do have harmful compounds. They do. I'm not going to deny that, right? But they are by no means anywhere near as harmful as the combustible tobacco. So what does nicotine do that's harmful? I'm just going to raise this because people are going to ask it. It can raise your heart rate. It can raise your blood pressure. That's basically the main harms of nicotine, but they are far, far less than the toxins that are created from burning tobacco. Nicotine on its own is really, really not that unsafe. Yes, it can raise your blood pressure. Yes, it can also increase your heart rate. But long term, does it do any substantive damage? It doesn't seem like it does. So if we are to look towards harm reduction, what we're really doing is we're saying, let's find people-centered policies for tobacco use. That is really what harm reduction is about. It's about saying, let's focus on the people that are most affected. So if I was to use an analogy, for example, I work in the space of opioid use. And I can say, you know, I work mainly with homeless heroin users. What do we do to reduce the harms of heroin? We look for a substitute. And that substitute is a medical opiate, which is highly regulated, which has a longer half-life, which means that people aren't going around looking for a fix every 4 to 6 hours. And it can be down titrated and up titrated according to need. So it's a much, much safer option, right? If we're looking at tobacco harm reduction, we're saying the individual does have choice. Because at the end of the day, if we don't look at individual choice, and I say this as somebody that works in the health space, we've lost that person altogether. If we say to somebody, just stop smoking, it's not going to happen. You know, they're going to hide it. And then once they hide it, we're playing soccer in the dark. We're not playing soccer in the light. If we are people-centered, we need to be able to say these are alternatives. Without alternatives, it's unlikely that people are going to simply just cease from any substance. We know this with alcohol. If I was to say to anybody here, please stop having sugar in your diet, you will say to me, okay, if I stop having sugar, what am I going to have so that I taste that sweetness? Then I'm going to say raw honey or agave syrup or maybe date syrup or something, right? But if I say nothing, people will stick with sugar. It's the same with any other substance. And we need to focus on ultimately what are the long-term health outcomes. And we know for a fact that nicotine on its own is by far less harmful, if harmful at all, in comparison with combustible cigarettes. Now, this does not mean that there aren't major quandaries in relation to tobacco harm reduction. There are debates, there are issues, there are problems which have been raised, and I'm going to speak about them because they're going to come up anyway in the conversation. The most important one that comes up is the issue of young people. What does it mean for young people if we offer these alternatives, all these substitutes, all these non-combustible forms of getting nicotine into our bodies? What does that mean for young people? Well, here's the problem, right? If you're a young person and you are deciding, I'm going to experiment, which most people when they're young do, what would you rather your young person has access to? Because they will experiment, right? The way to deal with the youth issue is precisely, much like the previous speaker was saying, to develop regulations around access to these products. And I'm not going to argue that this should be separate from the existing Tobacco Act. In fact, I think that these should be included in the current Tobacco Act. I'll talk about that in a second, right? The public health quandary is also about who's harmed and when are they harmed. And just think about this for a second. When we have combustible products, right, we are harming more than just the individual smoker. We are also harming other people too. So if we have non-combustible products, we are also providing a public health product which is far less harmful. We then, of course, have to think about access and how people get access to these new products or these existing products, nicotine products. And that means looking at pricing right, you know, because you don't want to outprice it so that the vulnerable groupings that I've already spoken about cannot access these products that are less harmful. And the other thing that we need to make sure is that we stop the misinformation. The misinformation that nicotine is as harmful as tobacco is. Nicotine is part of tobacco products, but on its own, it is less harmful. And we also need to stop the language that vapes and other nicotine-based products are a gateway to smoking tobacco products. That has not been proven true at all. So what is really important in the public health harm reduction space is to make sure that the right information is given. Because I want to say this, the wrong information can also be very, very harmful. So too can the wrong legislation be harmful. So we talk about the harms of substances, but we also need to think about the harms of legislation. So what would it look like to include harm reduction into legislation? In this case, the legislation in relation to tobacco and other cigarettes, other nicotine products. Well, firstly, we'd need to look at what are the public health benefits. And there are many. The first would be that it reduces smoking-related disease and mortality rates significantly. Secondly, it's also a very pragmatic approach. It gives a solution. It acknowledges that abstinence has limitations. And we all know that. When somebody tells us stop doing something without any alternative, the chances of that being successful are very, very, very low. So I'm going to use the example of the heroin space again, or the opiate space. We know that the abstinence-based programs that exist, where people are told to stop, just stop, have a 7% success rate, a far lower success rate than providing substitutes, which you can eventually down titrate, right? And what this allows for, if we move in the harm reduction space, if we start talking about what we can bring in to reduce the harms by providing alternatives to smoking, we then allow for stakeholder collaboration. We bring together into deliberative processes where people can debate, they can engage, they can ask questions, public health people, the industry, both the tobacco industry and those that are creating these alternative nicotine-based products, and consumers, because consumers are very, very important. The people that actually use these products, both cigarettes and the alternative products. And in doing this, in having these stakeholder collaborations, we move away from a highly moralistic approach to one that says, let's engage, let's talk. The answers lie in deliberation. The answers lie in saying what is less harmful. And if we do that, we then create regulations, laws, legislations that are less harmful, that meet the public and the individual where they're at, and that provide alternatives and provide solutions. Now, these solutions, just by the way, are not just important for the user community, they are equally important for clinicians and practitioners such as myself. So if somebody comes into my practice and they say, I'm smoking 40 cigarettes a day, but I know that I have a cardiac problem. And I've tried to stop smoking, but I can't. And I say to them, well, just do it. Just stop. They're going to walk out of my office and may never come back again. But if I say to them, let's see what alternatives are available that we can try, maybe that will work. That gives hope, that gives possibility, and it also leaves the person feeling less stigmatized than they were if they simply told that everything that they're using is bad. And stigma, by the way, creates more harm than anything else. It actually, when you feel stigmatized, whatever substance you're using, you're probably likely to start using more, right? We know that punishment and stigma creates more harm. We know that if we send people to prison for using drugs, they come out and they use more. And in fact, they overdose, right? So these kinds of stances, these abstinence stances that don't offer an alternative, are extremely harmful, unintentionally, because what the drafters of this bill are trying to do is act in good conscience, is to reduce harms, is to stop harms. But the pragmatic approach to doing it may be missing. So, in terms of the legislation under discussion, what do I think is important for us to consider? So, firstly, we have to embrace what the scientific evidence is. And more evidence is coming out, which is stating that it is important to move towards smoke-free products, in other words, products that are non-combustible, and to understand what it is that nicotine does and doesn't do. We need to engage with the scientific evidence. And most of the scientific evidence is now pointing to the far less harmful outcomes of nicotine, if there are any at all, than tobacco. But this needs to continue. We need to continue doing research, and I'll tell you where the research is missing at the moment and where we need to go. But what we know for a fact is that vapes are very effective in cessation, much more so than any of the patches or anything else, or the nicotines that have been used up till now. Secondly, within the Act, it is really important that we talk about harm reduction, and that harm reduction be woven into this Act or the bill. And that in bringing in harm reduction, we also talk about how to regulate products based on their actual risk profile. So, for example, we know that we don't want people under the age of 18 to be accessing any of these products, right? Because we know that ultimately there is a harm associated with nicotine. It's far, far less. It's probably negligible, but there is still a risk and there is still a harm, right? So how we deal with different population groupings can be accounted for within the same legislation. And then it is important for people that are in the legislative space, in the public health space, to monitor the outcomes of new legislation, and then to adjust policy according to what the outcomes are. Laws change, they get revised, but we need to make it as evidence-based as possible, and as end-user based as possible, and as people-centered as possible. And then lastly, this keeps coming up. We need to protect youth while helping adults. And when I talk about helping adults, we've got to say that the adults that we need to help are those that are using tobacco, cigarettes, because it's helping them cope, because it's reducing stress, because it's giving them a moment, because they may have social inadequacies, and when they smoke, they feel that they can engage with others. But more importantly, we need to be helping those adults who have chronic illnesses that need to stop smoking combustible cigarettes. And if we don't give them an alternative, their health outcomes are going to be terrible, and we know this already. So my plea is for us to consider at least incorporating harm reduction into the legislation, and also engaging with nicotine substitutes across the range. Thank you very much, Chair.
Thank you, Professor. Now, we are a professor in which unit in the Stellenbosch?
At Stellenbosch University, it's the Center for the Study of the Afterlife and Violence and the Reparative Quest. It used to be called the Center for Intergenerational Trauma. You would have probably heard of it in that way. And at the Australian National University, this may be of more interest, Chair. I'm part of a center which is called the Regulatory Network Institute, and that particular department is actually concerned with regulation across the board. So I am involved in the regulatory space as well.
Okay, honorable members, here is the presentation that you will be interested to interact with. I will then start recognizing the hands. This time around, I saw the hand of Dr. Leroux first. That would be number 1. And the second hand is that of Honorable Van Staden. Honorable members, shout if you can't raise the hand. Honorable Kumalo, you are number 3. Honorable Zungula, we are number 4. Honorable Dr. Litape, we are number 5. Let me see. Honorable Mare, we are number 6. Honorable Sine, we are number 7. Honorable Motubatsi, we are number 8. There's always a hand that fails to get up. Honorable Treko, are you able to raise your hand? Okay. Honorable Shabangu, we are number 9. Honorable Treko, are you able to raise your hand wherever you are? Maybe not. Honorable members, let us follow the same practice. One honorable member has asked a question, you then take over. Started with Dr. Leroux, followed by Honorable Van Staden, the third Honorable Kumalo, fourth Honorable Zungula, 5 Honorable Dr. Litape, 6 Honorable Mare, 7 Honorable Sine, 8 Honorable Mutubatsi, 9 Honorable Shabangu. Thank you very much.
Professor Mark, thank you very much for your presentation. Very interesting perspectives and particularly helpful. I think because I think that the intention of this committee is to make sure that we that there is as little harm as possible done to the South African population, and we're trying to mitigate harms from smoking. We're trying to mitigate harms from vaping. We're trying to mitigate harms to families who live with smokers and people who live in and work in bars and in restaurants. And so I think that I think your approach is a very interesting and helpful one, and I really do appreciate your perspective. And I think it's the first presentation that's been done in this way. So thank you very much for that. I just had a few questions from your presentation, and I know you speak about being in the opioid harm reduction space, and you spoke about the success rate of pure abstinence versus medication. I just wondered if you could give us a sense of what it's. I assume that you're talking about medications like methadone as a way to reduce harm. Just in terms of success rate of 7% pure stopping. I know it's not an easy thing to kick, so I know it's not going to be 100% success rate, but what is with methadone and well-rounded programs? Where are we getting with people who are in opioid harm reduction programs? How are things? What are the figures there? And I assume that we could expect fairly similar numbers, maybe better in the smoking space. I wondered in terms of I don't know about the British experiment. I know that it was mentioned by a previous speaker as well. Don't know if you have the data in front of you, but they gave out vapes, I think particularly to pregnant women, as a way to try and stop pregnant moms who are pregnant from smoking. And I don't know if you have any data on that, how successful that was. Has there been any research done on that harm reduction process? One of the things that there's been criticism from the Department of Health on is this idea of harm is harm, and I would just like to get your perspective on that sort of specific thing that's come out quite a lot in the engagements in NEDLAC. They've spoken quite a lot about harm is harm, and we need to mitigate any harm. So your perspective on that specific approach that is being used, and then from your perspective, the harms that this legislation, as it is currently put together, might cause. So you mentioned that legislation can also cause harm, and so I'd like to get a sense of that and how you've mentioned that there's a few things that you'd like to bring in, like a harm reduction approach in the legislation, but are there any specific parts of the legislation that you think would cause harm? And then finally, I don't know if just a sense of the success of harm reduction in terms of, you said that vaping is probably the most successful. I've seen some data. Could you give us a sense of comparing pure abstinence with using nicotine patches, et cetera, versus vaping, which has I suppose I've never heard the approach before, but not only the nicotine replacement, but also the action of smoking, which is somehow stress relieving. How that, if you have any data about the relative success rates of cessation of smoking in those three approaches, I'd appreciate that. Thank you very much.
Thank you, Chairperson, and thank you, Professor, for your presentation. It's much appreciated. Only two questions from my side. You've been speaking about the scientific research this evening. Can you please provide this committee with scientific research in this regard? And then my second question is, you are talking about we need balanced regulations in our legislation, and I agree with you on that one. Would you say, do you then believe that the existing tobacco legislation is sufficient enough, and then we can just amend and strengthen the regulations to bring it to a more balanced perspective? Thank you, Chair.
Thank you very much. May I request Honorable Khumalo that you stand down a bit, maybe swap with Honorable Shabangu. Honorable Shabangu has written to me that she's got a challenge with the battery, that we allow her now, and then Honorable Khumalo will come last if your battery is fine. If that is fine with you, Honorable Shabangu, thank you very much, Honorable Khumalo, for agreeing to swap. Shabangu, come now. Has your battery died, Honorable Shabangu?
She's got a network problem, Chair. She's load shaded.
Okay. All right. I thought I was pulling her up in the event she's still able to, but I'll be updated if she's not able to completely. Then let's follow the same. Honorable Khumalo, come through now. Thank you.
Thank you very much, Chair. Thank you, Professor, for your presentation, but I'm having some questions. You say harm reduction is a public health measure. Can you tell us which other instances where other harm reduction tools or medications are advertised to and targeted at children and even promoted by celebrities? You talk about autonomy and choices as key to empowering individuals to make their own decisions. Could you address the deeply concerning direct targeting of young people through advertisements and marketing tactics that prompt initiation? How does this tactic equal empowerment? Lastly, Chair, the professor have said she's having a practice that belongs to her. I want just to check, Chair, how many patients who are addicted to cigarette have you treated with vape in your practice? Thank you, Chair.
Evening. Thank you, Monique. Thank you for the presentation. I think it's good to hear the other side that is talking about harm reduction. One of your slides spoke to the policies. There must be policies to prevent youth initiation. Practically, what do those policies look like? And to prevent youth initiation, particularly when it comes to the alternative products, because I think that's the fear that has been highlighted by majority or some of the members of the committee. Practically, what do those policies look like? Secondly, from your perspective, having read the bill, with your experience in terms of dealing with the smokers, is the current bill regulating products according to their risk profile, or it uses a blanket approach regardless of the different products as well as the harm attached to each product. Thirdly, as an expert, is the current bill giving confidence that it is based on research and science, or it is driven by fear and misconception that all harm is harm? And also, from a expert research or scientific point of view, is the notion of all harm is harm a notion that should form the basis of legislation? Or do you think perhaps a different mantra must be used when it comes to addressing or formulating laws? Then lastly, how does the government achieve a risk balance? Because you did highlight the issue of having a risk balance, but practically, how do you think that should be done? Thank you.
Check. I'm not really sure who's next. Am I next, Chair? Letlape speaking. Am I next, Chair?
Dr. Letlape, you are next. Yebo.
Okay, thank you. I just have a question which has been asked 2 or 3 times before. What we've had from the department is that harm is harm. Now, if that becomes the new outlook of the Department of Health, that harm is harm, what impact will it have on other areas where harm reduction has been supported by the department? For example, with heroin users, for example, with provision of condoms in HIV and AIDS, even though it's not 100% protective, we promoted that to reduce harm. Once it's now shifting on harm to harm is harm, what long-term impact would that have? Or is the harm is harm notion specific only in relation to tobacco? Now, most of the deaths that occur in people who use tobacco, it's long-term users, it's adults. Do you think they deserve any consideration from this bill in terms of things that could be made available to them to reduce harm to them? Examples have been given where the UK said, not just to pregnant mothers, but to all smokers in their smoking cessation clinics, they launched what they called a swap program. Come and swap your cigarettes for vapes, because they were going to reduce harm. So for me, since your main theme is about reduction of harm, I just want to hear from you specifically, because the proposers of this bill say harm is harm. Thank you, Chair.
Chair, can I come in? It's Fisani. If I'm audible.
Must firstly ask Honorable Mare to allow you. After yourself, thank you very much. We had given you a come, and then Honorable Mare, that's a bit, she had indicated she had a load shedding problem. Come in, Honorable Shabangu, thank you.
No problem, Chair.
Thank you, Honorable Mare, and thank you, Chair. Greetings to Prof. Mark, and thank you for your presentation. I'm load shedded. Maybe I might have missed a bit, but not. I think I grasped everything that you presented. Have you viewed the data about the effectiveness of what these so-called harm reduction tools at the population level in South Africa? If so, can you share the data with us for us to review, especially data on harm reduction since the e-cigarette have been around for about 15 years? If you go to South African data, Prof. Mark, these tools are not reducing harm, but instead they increase harm, since more people end up using both this product and the cigarette that they were using before. If you agree that there is still nicotine on this product, I've witnessed a lot of people that have been using this product, but they end up smoking cigarette, because the effect of nicotine is that you become addicted, and then they end up smoking cigarette. So I'm just mentioning this so as when you answer this, you must know that there is some percentage of people that when they use this product, they end up using both. How would you then recommend this approach to South Africans? Can you give us examples of countries where what you are proposing has been done, and youth smoking and e-cigarette use prevalence have reduced or even stayed the same? If there's any countries that you can give to this committee as examples of what you are presenting, the evidence that you have seen. Thank you, Chair.
Thank you, Chairperson.
Yes, Honorable Mare, it's your opportunity now. You'll be
Okay,
followed by Honorable Sine Mutubatse. There's the last one. Thanks.
Okay, I just need to understand. I was listening to what the presenter was saying, and I want to say thank you for another view on how you see things. But I have exactly the same question. Harm reduction is still harm, because you say that the person stops smoking cigarettes because it's harmful, that he rather smoke the vape, but the vape is also harmful. So I just need to understand, how is the harm reduction coming in? I just need to understand is if you see a teenage child, no, is doing drugs, and you see the harm it is doing to the person, because we can see in the streets how people are walking mad because of drug use, and you say to the person, no, you will decide when you want to stop using drugs. You will decide, because otherwise you're not going to come to my office. I want to understand, are you saying that you give the person to decide, because they're not going to come back to your office? And I want to understand is because you are speaking as a doctor, yeah? And you are having your own little practice, and you are speaking as a person that is going to lose money, because you're not going to have patients that's going to come in and to see you, because you're going to say to the person, look here, don't do this because it's not good for you, and then you're going to lose the person. I just want to understand this thing, because for me it is extremely, it's like saying to the person that is gambling, no, don't gamble in the casino, go gamble in a safe place in your house. It is still addictive, it's gambling, so where is the harm reduction in that? I just need to understand it, because the way the presenter was saying it, she knows what she's talking about. She have clear, but she must come up with evidence to say that, this vaping, because we asked the previous person, is vaping harmful? He said, no, I don't have the medical view if vaping is harmful or not harmful, but I know it is better than smoking a cigarette, but it's having nicotine in it in any case. So does she have concrete evidence that moving from the one thing and you put another thing in place, is it not going to be harmful for the person? Thank you, Chairperson.
Thank you, Chairperson, and thank you for the presentation. My first question, the presenter, you are proposing different countries that you are saying we must copy from them. You mentioned New Zealand and the United Kingdom. Are you aware that they are currently having a problem with youth vaping increasing even more than adult vaping? Are you also aware that because of this problem in some of these countries, and in order to protect their youth, the UK has banned disposable vapes, and other countries are seriously considering other measures? Even in these countries, are you aware that these products are strictly regulated? So I want to know why are you making this recommendation for South Africa? What informs this recommendation to us? And then my second question, can you give us the clinical or laboratory study that was done to establish the 95% safety you spoke about in your presentation? How much safer is snus compared to cigarette? And again, switching from one addictive nicotine product to another addictive product, is it the same thing as cessation or what? Thanks, Chair.
Well, thanks very much, Chair, for the opportunity. And thanks, Prof, for the presentation. Now, most presenters who advocate for vape do so with the thinking that it helps people to quit. Now, I want to turn that around to say that is vaping not an initiation, especially with young people who have not been smokers? Is it not an initiation or a prelude towards smoking cigarette? And is there any evidence that you can present to this committee on the success of the method that you have applied so far? Are you suggesting that the bill, based on your presentation, the bill is treating should not actually treat cigarette and vaping the same? And my last question would be just to establish, are there any programs that you are involved in, advocacy programs that you are involved in, to promote or to woo people around the method that you have presented to us? Thanks very much.
I think Honorable Mutubatu was the last one.
Okay.
Is there another hand after Honorable Mutubatu? No. Okay. Professor Marx, just following on what the last speaker has said, one would have wanted a bit of statements that are quantifiable than maybe just leaving to say what you say. You say vapes are much better than nicotine pouches, much better than tobacco. That statement, also my grandmother can say so, but maybe we would have loved to see science in terms of actual figures to say there is this harm reduction of so much. But just to leave with a statement that also my grandfather can make, probably may not be that helpful. This bill is talking strongly on strengthening what was left not being strong on tobacco, like when do the packaging plain and all that. But you probably should be well aware that there's never been an act in the country that deals with vapes, and there are so much all over now, and therefore, yes, we could learn from some other countries, but I don't think it would be a fair comment to say, don't be strong on this and that, as if whatever was there as a practice was ever normalized. It was something that people just invented, and they said, was, while there will be so much criticism on this tobacco, which I share, tobacco has always been in the field with the mint and menthol flavors. Once you are saying you are going to be, or those who are working around you are going to be out of market if the flavors of grape, vanilla, ice cream, everything is not taken off. It's not a fair comment. Was you already establish a particular practice that you can also outdo if there's a regulation. So the notion that there may not be any success of vapes if the flavors are removed, one would say there will be a less attraction to young people if these flavors are not. So there will be statements like that to say, if you are pushed to allow vapes to be there, and then but these flavors that are make them palatable to young people, vanilla, strawberry, no, you are attracting people who want vapes. They will always go for vapes, whether they are in mint or menthol. They will not say I'm stopping it because what we have created as a precedent was actually not the right way. We introduced it even before regulations were there. So when you then regulate and say, I allow vapes, but not this one and not this one, not a single one, not with this type of flavor, the industry and yourself should be actually acceptable. But the last one from my side, I would have wanted to be educated a bit by a professor on these issues. Do talk about toxins that do remain even there on vapes. And probably not just say they are less harmful. What other harm is there that remains with vapes that you will say, yes, it is removed if you don't take tobacco, but what are other things that are still risky and harmful that are there? Let's know about them from your research in this space, and not just say, yes, they are less harmful, but that's a statement I'm saying my grandmother could make. But what are the things that you can quantify, indicate, and show that this is what is less harmful about this product? Thank you very much. Then you can support us with your responses.
Okay, I'm going to try. I'm afraid that I've been trying to handwrite and my handwriting is appalling. So I'm not going to get everything. I'm a typer and I couldn't type because I'm on my computer. So please excuse me. I just want to just go back a little bit in our history and talk about what happened when we did try to be prohibitive in the past. And what comes to mind immediately is COVID lockdown and the ban on cigarette smoking. And what that did, it didn't stop it. It just went underground and we landed up smoking cigarettes that were probably more harmful than those that were a little bit more regulated. I'm not a fan of cigarette smoking, even though there was a time when I used to smoke 2 cigarettes a day myself. As a single mom, as a time of stress release, when I put my children to bed, it was my come down. Now, I'm saying this because I think it's very important for us to all be honest about where we stand in all of this in our own positionalities. And during COVID lockdown, because I was running a methadone program in the underground parking lot of Moses Mabhida Stadium, I too was trying to find cigarettes in the middle of a prohibition lockdown. So did that stop it? No, it didn't. Did prohibition make it more problematic? Yes, it did. And I just think that we need to take our memories back a little bit. So please excuse me if I miss out some of the really important questions that people have asked, but I will try to answer as many as I can. I do want to say that, I'm here predominantly as a harm reduction advocate. I'm here not as somebody that is a scientist in relation to nicotine. So many of the questions that you're going to ask about, the more quantitative stuff, I'm a qualitative person, by the way, I'm not going to be able to answer, but I can tell you this, that there is an enormous evidence-based at the moment around, the less harmful effects of the kinds of products that I've been speaking to, including vapes and other nicotine alternatives as compared with cigarettes. That I think, and those are the importance of the emerging evidence, is that it is from people that are not linked to industry. This is very important. When we look at the evidence that we want to take seriously, we need to say that it is peer-reviewed, that it is not linked to industry, and that we recognize, in my case, as a scientist, I would like to know that these come from reputable organizations, including universities, because there's some good universities and some bad universities. And so I have been sitting in recently on a number of international debates around this issue. And what I've been amazed by, and I want to say this, is by the kinds of academics, and I'm talking about very high-profile academics from very good universities across the world, and I'm talking about top universities, that are all moving away from this idea that we need to just see all nicotine products as harmful to a more harm reduction approach. And I'm going to say this is the tidal wave. It is moving in this way because of the evidence that is coming out. So I want to put that as something on the forefront. And I also want to say that, if people are wanting the committee to be provided with evidence-based research, there are many of us that can provide that, including myself, because I'm reading about it, but I don't have the numbers for you right now. So I'm not even going to pretend that I do. So I'm going to try and get through as many of the questions as I can. And I'm really sorry if I leave some out. The first speaker around methadone and how do we evaluate what success is? Well, we do it. There are two things, right? Harm reduction is a spectrum. It's a spectrum that goes from abstinence to less harm, right? And so abstinence is on the harm reduction spectrum, but it's one outcome of many. So how do we measure what is successful in the harm reduction space, for example, of a heroin user? Heroin user who goes onto a substitute like methadone or Suboxone or Subutex or one of these medications, what happens? Their quality of life increases, right? They are no longer using products that are not legislated or not regulated. They are no longer looking for a fix every 4 hours. They are able to go from a high level of medication and down titrate slowly. But if need be, they can stay on the medication for as long as they like without it being very harmful to their bodies, right? And what we see with methadone is people start working, they start looking after themselves, they start caring for their children, they start building their self-esteem. So the quality of life indicators are what we're looking at. There are also economic factors, both at the macro and micro level, of moving from substances like opiates to a more regulated substance like methadone, which you can down titrate to a zero use, right? Does it happen that people stay on methadone for the rest of their lives? Yes, it does. That is true. Is this a problem? Not necessarily. We don't say to people who have diabetes, you need to stop taking your insulin because it's a problem, right? These are chronic illnesses, some of them. Substance use can be understood as a chronic illness, right? So yes, the UK does promote nicotine-only products. And yes, they have done this program of swapping. And I think that it is an interesting implementation tool that we need to be thinking about, where we do give people the option to say, try this and see if it works. If it works, great. Now, somebody asked me a question, and I'm not going to refer to individual names because I haven't been able to do that. But in my own practice, people are asking, firstly, I'm not interested in people coming back to my practice for monetary gain. That's not the case at all. Please remember, I come from an academic background. The private practice has been on the side. It's not a money-making thing. It's me, retaining my professional practical sort of knowledge and skills. But what I do want to do is I want to retain people in treatment And in this case, in psychosocial treatment. Because if I then say to them, you're a bad person because you're smoking, they're going to exit treatment. And they may be coming to me to deal with a bipolar issue, or they may be coming because they've got depression, or they may be coming for some other reason because they're not getting on with their spouse. And if I then stigmatize them and I don't say, let's find another option, they're going to exit. And they may exit all kinds of treatment. And that is true of any sort of healthcare and allied healthcare if we stigmatize people. So I wanted to say that that's my motivation. And have I done this with people? Well, this is an interesting thing. So I work together with a GP very closely, and we've been working in the harm reduction space. And in the last couple of months, we've been discussing exactly this. What do we do when somebody comes in and we know that they have a chronic illness and we know that they're not going to give up totally? And we know that they are addicted to two things: the modality, that oral and that action of taking something in and out of your mouth and blowing smoke, or not blowing smoke, or blowing something, inhaling, and also the nicotine as the substance itself. And what we found to work really well is a combination, and this is different from what was presented earlier, of totally nicotine-free vapes with the pouch. And this has been very, very useful, because what people are getting is both. They're getting that sensation of being able to smoke, even though there's no nicotine, with a nicotine pouch, which is actually, giving them that fix. So there are various ways in which you can substitute. That's the one that we've been using in my practice with the GP that I work with, and it's been really, really effective. Are all harms harms? Are they all equal? Of course they're not. It is much more harmful to have certain forms of alcohol than others. Not all alcohol is equal. And not all amounts of alcohol are equal, which is why we regulate the alcohol industry, because we know that people are not going to stop drinking. But we do know what is a more harmful amount of alcohol to use and what is less harmful. So does that mean that alcohol as a general substance is harmful or not harmful? We know that there are harms, but we also know that if we drink in a certain amount, the possibilities for harm are less, right? So yes, there are harms associated even with minor amounts of alcohol, but there are people that argue that actually there are health benefits. So all of these things are up for debate, and I think the more moralistic we become about this, the less we are open to answers. And for me, that is a real question. Has vaping led to cessation? That there is a ton of evidence around. We do know, and it's been raised many times, that it's not just in the context of Sweden. Laws have been and regulations are being reviewed all over the world at the moment, because there is so much evidence that vaping does lead to cessation of smoking. Do people go from vaping to smoking? Generally not, but are there people that vape and smoke who have been smokers before? Yes, absolutely, right? In the same way that there will be people who are using methadone but are unable to totally give up heroin. Ultimately, the aim is for them to do that. They will drastically reduce their use of heroin and other opiates that are more harmful. So, these are not absolutist ideas, but we do know that those people that do get onto a substitute reduce the harms dramatically. So if we look at methadone, if people move to methadone as opposed to heroin use, or they reduce their illicit opioid use dramatically, the harms are far, 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 far less, and quality of life improves. And I think that's what we need to be thinking about. So in relation to submission of scientific research, I'm more than happy to provide that to whoever wants it in abundance, because it is coming up. Where we are stuck, and I'm going to be very honest about where the evidence is lacking, because it's where we need to be focusing. We don't know the long-term effects, for example, of a nicotine pouch. We know that it's less harmful. We know that nicotine as a product has certain substances that do lead to, and I was very honest, I did not try and conceal it, that do lead to issues around blood pressure and increasing heart rates. And we do know that there are minor traces of chemicals and toxins in nicotine that, of course, are harmful, but in comparison, negligible. If we look at combustible tobacco. So I think, we do need to engage in the sort of space of relativity, because if we absolutist, we're going to lose the ball completely. So we do need to be doing more research on the long-term effects, and that is only beginning to happen. But can we wait another 10 or 20 years before we start looking at these substitutes as possible ways out? No, we can't. I think we would be doing ourselves and our population a huge injustice by doing that. So yes, definitely, the legislation, and I want to say this in relation to the last point that was made, or the last 2 points. We have in our National Drug Master Plan, which has been in existence for a number of years now, a very strong positionality on harm reduction. And that carries over into other spaces in the legislative field in our South African law. So in many ways, this act, however you want to define it, is actually going against the rhetoric, the principles, the frameworks, the value systems of many other laws and acts that we have in South Africa. And we need to have coherence. We need to have coherence. And this is important, particularly for the Department of Health, the Department of Social Development, that we're able to speak with one voice. If we talk about harm reduction, we're talking about harm reduction in relation to all substances. Okay. So what can we do in relation to young people? I think if we learn, for example, from the New Zealand case, and New Zealand's an interesting case, by the way, because they moved from a very prohibition approach to what I would call a space of regulatory tightening, which is maybe where we need to be looking at. So what they've started to do since, for example, mid-2023, is to say that and this is how they've introduced the sort of less harmful space, is to say, there is a ban on the disposable vapes. We've heard about that already. Restrictions on flavors, so getting rid of like candy flavors, cartoon names, all of that kind of stuff that appeal to young people. Having buffer zones, no smoking zone, no vaping zones around and in schools and other institutions where youth congregate and are likely to go. Battery safety requirements, increaser retailer fines. And I think that it's looking at the retailers that is really, really important, because that's where responsibility lies. It lies with industry, but it also lies with the retailers. And then, of course, when people go against these new bans or these regulations, we need to ensure that there are some severe fines that are attached to it. Now, do fines always work? No, they don't always work, because some people can't afford fines, right? So then we need to think, what are the alternatives? If you get a young person, for example, smoking in a school or in the surrounds around the school using a vape, what are the measures that we bring in where fines are not a possibility because they're not earning? So we need to think about these things. And I think it's going to take some concentration around that. I do want to say as well that the evidence that exists globally is not going to be that different in South Africa. What we do know about South Africa, and this is a scary reality, is that whereas in places where alternatives and substitutes in relation to nicotine products have been brought in, smoking has reduced dramatically, right? So we're talking in Sweden less than 5%. We're talking in other countries also massive reductions. In South Africa, what do we have? We have an increase in smoking cigarettes. So we've got a serious problem. And people are smoking for a number of different reasons, right? And they're also smoking because cigarettes are fairly cheap still, particularly those that are, available on the black market, right? So the sellers, the retailers need to be targeted. The industry needs to be targeted. The advertising needs to be targeted. The public health domain and specialists need to be giving out the right information. They need to be saying what is less harmful and not saying that it's not harmful. Because I'm not a person that is going to stand up here and say nicotine does not have harms. It has harms, right? But they are substantially lower. And we do need to engage with this as we do in any other spec of harm reduction. So, Dr. Letlape, that is in response to your question about is harm harm? Yes, there are harms associated, but we have to go for what is less harmful. We really do. And, I think we should be doing this, by the way, in all aspects of legislation and of governance, not just in relation to what we're talking about now. I think using harm reduction as a governance technology mentality is very, very important, and it's very, very useful. And it also speaks directly to people and meets them where they're at. So in South Africa, it is true that we don't have enough data. And I think if nothing else comes out of this conversation, we do need to be saying, what is the evidence that we need so that we're able to make the arguments that we want to make, because we are basing a lot of what we know on evidence and data that is not South African based. But I want to say this, what happens in the rest of the world, we are part of a global network, if places like Malaysia and China and a variety, and I'm not necessarily including China in this, but a variety of middle to low income countries are moving towards legislation that is in the harm reduction space around tobacco use, then I'm not sure how different South Africa is. And I think we keep on thinking that South Africa is exceptional. It's not. What is exceptional is the rise in tobacco smoking in Africa as a continent, but in South Africa specifically. Okay, so then, this thing about prohibition and, what is worse? The biggest exhibitor of what happens with prohibition and what happens with bans and what happens with trying to to regulate in a way that doesn't meet people where we're at is the opioid epidemic in the United States and the dismal mess that the war on drugs has had on people. Why is this? Because people have started and continue to play soccer in the dark. And we can't anymore, in the case of the US or anywhere else where drugs are criminalized, bring it out in the open, let people ask for help, and try and find suitable and less harmful alternatives. It's a real, real problem. So I think for me that needs to be top of mind. Is youth vaping increasing? It probably is. In fact, I could almost certainly say it is, But here's the thing, right? If young people didn't go to vaping, what would they be doing? This is the question. Now, if we look at a place like Europe, I don't know if anybody had been to Europe, let's say 15 years ago. All young people were smoking cigarettes, so were adults, right? Now, if you go to many of the European countries, people may be vaping, but nobody's smoking. And there are serious, serious reductions in harm in relation to that. So the problem that we have, the dilemma that we have, is we don't know what young people would be doing if they weren't vaping. What substances would they be using? Now, I have a 20-year-old living with me, and he has gone from starting to smoke because his friends were, to having a conversation with me about what is less harmful. And because he was smoking, he got addicted to nicotine. He does have ADHD, and the nicotine plays a role in that. And now what he's doing, and he's really proud of himself, is he's using the pouches, and it works well for him. It works really, really well for him because he is not so much addicted to the modality, but he is addicted to the nicotine. And I'm hoping that it will be reduced as we start using the pouches less and less, which is what's happening. But if I take those pouches away, he'll go straight back to probably using tobacco or something else, right? So we do need to think about, lesser harms. And therefore, no, harm is not harm. There are more harms and less harms. Is vaping a gateway? Now, this is not the only place where people speak about gateways. And I'm going to say this as somebody that's been in the drug space for a very, very, very long time. This language of gateway is extremely unuseful. There's very little evidence that vaping leads to smoking. In fact, I have not seen any evidence that convinced me of that. I can send as much information as you want. It's the same as people saying that cannabis is a gateway drug to other drugs. That is simply not true. There is absolutely no evidence to support that, except perhaps, and I don't even know if this is true, in people that have severe mental health issues. And even then, I'm not convinced about it. So people use substances for various different reasons. And I think what is critical about the harm reduction space is the question that you ask is, why are you using this substance? What does it give you? It gives you something. It gives you something. If I say to you, you have an obesity problem, but you're drinking a lot of caffeine, and this caffeine is raising your cortisol levels. Your cortisol levels being out means that your insulin is no longer regulated. You need to reduce your amount of coffee that you're drinking. I'm not telling you must stop, but we start with reducing. Or we start and we say, okay, what tastes similar? People may have heard of something called mesquite. What does mesquite give you? It gives you the taste. But you want the hype? Have some green tea. It's much more effective. We combine those two. We look at them. We say, is this going to possibly reduce? And hopefully at the end of the day, if you've got a problem with weight or any other, you're having heart palpitations and you're having a lot of caffeine, what are we going to do that will make it better, right? If I say to you, just stop, I'm going to lose the battle altogether. Okay. And then the other question that was asked is, do we need to distinguish between vapes and other nicotine products? Yes and no. In the sort of the current legislation, it's really speaking towards electronic cigarettes, vapes, and so on. And we're not engaging with the other nicotine products, even though they're on the market. I think we need to be engaging with all of these as substitutes, as less harmful products, as ways of getting to tobacco smoking cessation, which I think is the major harm. Not only the harm to individuals, but also the harm to people that are exposed to smoke. So not all harms are equal. Yes, there are always harms, but we are trying to look at what is least harmful, most practical, most evidence-based. Chair, you spoke about the quantification, which I haven't given you, and I absolutely am not going to be able to give that to you today. If I went back, I could bring it to you, but I'm not going to provide that today, and it would not be my own research, because as I've admitted, I'm far more interested in the qualitative research space, although I read the quantitative research space because it informs the way that I think and the kinds of advocacy work that I do. So what I can say is that I have been present in a number of tobacco harm reduction conferences, mostly across the globe. There's one coming up this month in Poland. And I went in skeptical. I went in thinking that people from Yale and Harvard and UCLA and Oxford and Gdansk and all of these universities that were present, went in thinking that they were going to be totally against nicotine alternatives. But every single person that stood up was a harm reduction advocate, and they were not selected because of that.
You are in your last 3 minutes. You are in your last 3 minutes.
Okay. So in short, Chair, what do I think we need to do? Because somebody said to me, what do we do with the current bill? The current bill, its intentions are good. And I think for the most part, it is positive. But where do I think it needs to change? A couple of areas. One, the language of harm reduction needs to come in, so it aligns with other legislation that we have in relation to substances. Secondly, I do think we need to add to that the other nicotine products that are available for smoking cessation. And thirdly, I really think we need to put our minds to what this means for young people in terms of advertising, in terms of flavorants, in terms of retail, in terms of all of that. And we can learn from places like New Zealand, which is a very progressive country, by the way, and has changed from saying no to saying yes, we need to engage with harm reduction. Thank you, Chair.
Right. We are glad to have met you and we have listened to you. And it will be part of a bigger picture of things that we are going to be considering as a portfolio committee moving forward. You need to be assisting us in the country. Certain countries have moved this way. It shouldn't be that nothing should be done, but it should be that you do this, and that. Please consider thinking about this, that, and the other. Okay,
Yeah.
this committee is seized with your presentation, and if we do need you, you're not very far from us, Stellenbosch.
No,
can
I'm not. I'm actually in Durban, but I'm linked to Stellenbosch.
Okay. Thank you very much for your
No
contribution,
problem.
Professor Max. And honorable members, that brings us to the end of our meeting today. I thank you very much. Your day started very early this morning. I'm glad you are still logged here very much. But let me wish you well and have a good evening. Please don't forget to log in at 9 o'clock tomorrow. It's not my call. It's a training of all of us as members of parliament. Enjoy the training tomorrow. Good evening to all of us. Thank you very much. Bye-bye.
Good evening, all.
Evening.
Thank you. Good evening.
Ni robale hantle.